So what we did in this study, outcome of patient with CML treated with third-line TKI, and this patient could receive any third-line TKI. We know today that the sequence of TKIs is not so well established. Yes, great outcome in the front line, but when it comes to third line, whether we sequence second-gen TKI or move somewhere else, that is still unknown. And therefore, we aim in this study to compare Ponatinib to second-gen TKI in a third line, since there is no randomized trial so far done. It's a retrospective analysis of 354 patients. We compare them to UPTIC and PACE trial who received Ponatinib in a third-line therapy, follow-up of almost 4 years. We excluded TKI mutation just in fairness to the second-gen TKI. We try to compare patient characteristics between the two groups, and we've seen in a group of patients who receive Ponatinib, we have a higher disease burden. Means more patients have 10% and more and failed multiple TKIs were enrolled in a Ponatinib. Despite matching to minimize these differences, still those who receive Ponatinib had more risk features and high disease burden. Then we look at the responses by what we call doing logarithmic assessment of response, and we've seen cumulative rate of response at a higher level with Ponatinib compared to a third-line TKI. And then we did look at the PFS before matching and after matching, and equally we've seen that Ponatinib is superior to second-gen TKI before and after matching, and then that was true as well for survival. For example, for PFS, there's around 25% difference between Ponatinib and second-generation TKI. When it comes to survival, we have 5% difference in survival as well. And then we did a multivariate model, and we showed as well that in this model, Ponatinib was the only favorable factor for survival. So Ponatinib is superior to other options. Now, when we look at the patient who had only 1% above, means those who are practically resistant to treatment, we've seen as well that Ponatinib was found to be superior. And here the PFS is substantially better with Ponatinib. It goes from 44% to 83%, and survival goes from 80% to 88% at 3 years, which is significantly better. And when we do the multivariate, Ponatinib remains the only factor predicting for favorable outcome. So in conclusion, we've shown that in a third-line therapy, Ponatinib is superior to second-gen TKI with a higher response rate, better PFS, and better survival, and it should be considered standard of care for these patients.